The code blue alarm screamed through Presbyterian Hospital, all available doctors to Trauma Bay 3. But when the young surgeon couldn't stop the bleeding, it was the janitor who stepped forward, pulled off his gloves, and said 4 words that changed everything. "Let me help you. Welcome to the Human Stories." Before we begin this powerful story of hidden talents, second chances, and the heroes who work in shadows, tell us in the comments where you're watching from today. And if you believe stories like this need to be told, hit that subscribe button, and help us make sure they are. Presbyterian Hospital stood at the corner of North Wells Street and West Superior Avenue in Chicago's River North neighborhood. The imposing brick and glass structure housed one of the city's premier trauma centers, serving everything from routine emergencies to the most critical cases that arrived by helicopter on the rooftop. HELIPAD. At 11:47 p.m. on a cold February night. The emergency department hummed with typical activity. Nurses moved between curtained treatment areas. Residents reviewed charts under fluorescent lights, and the constant beep of monitors provided a technological soundtrack to modern medicine. Eduardo Vasquez pushed his utility cart down the polished linoleum hallway of the third-floor trauma wing. At 52 years old, he'd worked the night shift at Presbyterian for 8 years, arriving every evening at 10 p.m. and leaving at 6 a.m. when the day crew took over. His navy blue uniform was always clean and pressed, his movements economical and precise as he went about his duties. Eddie had perfected the art of invisibility. Medical staff walked past him as if he were part of the hospital's infrastructure, as essential as the walls and lighting, but no more noteworthy. He mopped floors around their feet, emptied waste bins while they worked, and restocked supply closets without interrupting their conversations. This anonymity suited him perfectly. Dr. Sarah Martinez, a third-year surgical resident, hurried down the corridor carrying a tablet displaying lab results. At 28, she'd been at Presbyterian for 6 months, still learning the rhythms of the hospital and proving herself to the attending physicians who would determine her future. She barely glanced at Eddie as she passed, her mind focused on the patient in room 314, whose post-operative complications were keeping her awake. Eddie noticed her fatigue, the slight slump in her shoulders, the way she rubbed her eyes between chart reviews. He'd seen thousands of residents cycle through Presbyterian, and he could read the signs of someone pushing themselves beyond healthy limits. But observation was his job. Intervention was not. The hospital's trauma team consisted of Dr. Michael Chen, the attending trauma surgeon whose reputation for saving hopeless cases was legendary throughout Chicago's medical community. Dr. James Foster, a second-year resident with steady hands and an unfortunate tendency toward arrogance. Dr. Martinez, and a rotating cast of nurses, technicians, and support staff who formed the backbone of Presbyterian's emergency response capability. Eddie knew all their names, their schedules, their coffee preferences, and their personal struggles. He'd worked around them for years, invisible but observant, learning their patterns and quirks, the way a naturalist studies wildlife. Dr. Chen always arrived exactly 15 minutes early for his shifts. Dr. Foster ate the same turkey sandwich from the cafeteria every night at 2 a.m. Dr. Martinez left post-it note reminders to herself on every available surface, but they knew nothing about Eduardo Vasquez beyond his function as the man who kept their workspace clean. At 11:52 p.m., the evening's routine was shattered by the sharp, insistent sound of the code blue alarm. Code blue, Trauma Bay 3. Code blue, Trauma Bay 3. All available medical personnel respond immediately. The announcement echoed through the hospital's corridors, galvanizing staff into immediate action. Dr. Chen sprinted toward the trauma bay, his white coat flapping behind him. Dr. Foster abandoned his chart review mid-sentence and followed. Nurses dropped what they were doing and converged on the emergency. Eddie continued mopping, but his movements slowed slightly, his head tilted toward the commotion, and something subtle changed in his posture. Not alarm, more like the alertness of someone whose training had taught them to assess situations automatically. Through the glass walls of Trauma Bay 3, Eddie could see controlled chaos. Paramedics had wheeled in a young man, maybe 25 years old, whose motorcycle had collided with a delivery truck on Lakeshore Drive. The impact had caused massive internal bleeding, and his vital signs were deteriorating rapidly. Dr. Chen worked with practiced efficiency, barking orders while assessing the patient's condition. "Get me 2 units of O-negative blood. Stat. Foster, check his pupils. Martinez, prep for emergency surgery." But as the team worked, it became clear that this was beyond their usual capabilities. The bleeding was too severe, the injuries too complex. The patient was dying faster than they could stabilize him. Eddie watched from the hallway, his mop handle gripped tighter than necessary. Dr. Chen's hands moved with surgical precision, but sweat beaded on his forehead as he fought to locate the source of internal bleeding. The patient's blood pressure continued dropping despite 2 units of transfused blood, and the monitors showed increasingly erratic vital signs. "Pressure's dropping to 60/40, announced Lisa Wong, the trauma nurse whose 15 years of experience had taught her to read crisis situations with deadly accuracy. "Give me more light," Dr. Chen ordered, squinting into the patient's opened chest cavity. "The bleeding's coming from somewhere I can't see clearly." Dr. Foster assisted with suction, trying to clear the field of vision, but blood continued to obscure the surgical site faster than they could remove it. Dr. Martinez monitored vitals while preparing additional instruments, her hands moving automatically through procedures she'd practiced thousands of times. But Eddie could see what the team couldn't from their positions around the table. They were losing the battle. The patient was a construction worker named Miguel Santos, 26 years old, who'd been riding his Harley-Davidson home to his pregnant wife after a double shift building high-rise condominiums in the Loop. The delivery truck had run a red light at the intersection of North Lake Shore Drive and East Grand Avenue, T-boning Miguel's motorcycle and sending him flying 30 feet across the asphalt. Now, Miguel lay unconscious on the trauma table while Chicago's finest medical team fought to save his life. "I need better visualization," Dr. Chen said, frustration creeping into his voice. "The tear is too deep, and there's too much blood." That's when Eddie made a decision that would change everything. He set down his mop handle, walked to the hand sanitizer station outside Trauma Bay 3, and methodically cleaned his hands with the thoroughness of someone who'd performed the ritual countless times. Then he approached the doorway of the Trauma Bay. "Excuse me, Dr. Chen," he said quietly. Dr. Chen looked up briefly, annoyed at the interruption. "Not now, Eddie. We're trying to save someone's life." "I know," Eddie replied. "That's why I'm here." Something in his tone made Dr. Chen pause. Eddie's voice carried a different quality than the deferential politeness he'd shown for 8 years. This was the voice of someone who understood exactly what was happening in the Trauma Bay and had something important to contribute. "The bleeding is coming from a tear in the splenic artery," Eddie continued, his voice calm and precise. "About 2 inches below where you're looking. You need to pack around the pancreas to get better visualization, then use a running suture with 4-0 proline." The Trauma Bay went absolutely silent except for the beeping of monitors. Dr. Chen stared at Eddie, processing what he'd just heard. The janitor had diagnosed the exact problem and prescribed the specific surgical technique needed to address it, knowledge that should have been impossible for someone without extensive medical training. "How do you, Dr. Chen began, then stopped himself. This wasn't the time for questions. He followed Eddie's suggestion, packing gauze around the pancreas to clear his line of sight. Immediately, the torn splenic artery became visible exactly where Eddie had indicated. "Jesus," Dr. Foster whispered. "He's right." Dr. Chen began suturing the arterial tear with the technique Eddie had described. Within minutes, the bleeding slowed dramatically. The patient's blood pressure began to stabilize, but the team's attention was now divided between the patient and the janitor who somehow possessed surgical knowledge that should have taken years of medical school and residency to acquire. With the arterial tear repaired and the patient's condition stabilizing, Dr. Chen could finally address the elephant in the room. He looked directly at Eddie, who stood just outside the trauma bay with his hands clasped behind his back, a posture that suddenly looked more like military attention than custodial deference. "Eduardo," Dr. Chen said carefully, "how did you know about splenic artery tears?" Eddie was quiet for a long moment, watching the monitors that showed Miguel's vital signs gradually improving. When he finally spoke, his voice carried the weight of memories he'd kept buried for years. "Because I've repaired dozens of them," he said simply. Dr. Martinez stepped closer. "You've repaired them? Where?" "Forward Operating Base, Salerno, Afghanistan. Combat Support Hospital. I was the chief trauma surgeon for the 101st Airborne Division." The statement hit the trauma bay like a physical blow. Dr. Foster's mouth actually fell open. Dr. Chen set down his instruments and stared. "Your doctor, Eduardo Vasquez," Dr. Chen said slowly, recognition dawning in his voice. "I read your papers in medical school. The Vasquez technique for battlefield trauma surgery." Eddie nodded once. "That was a long time ago. You disappeared," Dr. Martinez said. "There were rumors about what happened, but no one knew for sure." "I didn't disappear," Eddie corrected. "I came home, and I decided I was done with surgery." Dr. Chen began connecting pieces. The incident in Kabul, the field hospital that got attacked. "You stayed behind to operate while everyone else evacuated." Eddie's jaw tightened slightly. 14 wounded soldiers. I couldn't leave them. "The reports said you performed surgery under enemy fire for 6 hours, Dr. Foster said, his earlier arrogance completely gone. "Saved 13 lives. Lost one," Eddie said quietly. "PFC, Rodriguez, 19 years old. Couldn't stop the bleeding from his femoral artery." The silence that followed was heavy with understanding. Every medical professional in that room had lost patients, but losing a patient while under direct enemy attack, after operating for hours without rest or adequate supplies, was a trauma that went beyond normal medical experience. "That's why you stopped," Dr. Martinez said, not a question but a statement of comprehension. "I'd had enough of people dying on my table," Eddie confirmed. "When I got back to the States, I couldn't handle the pressure anymore. Every time I held a scalpel, I saw PFC Rodriguez bleeding out while mortar exploded around us." Double quotes. Dr. Chen understood. Combat-related PTSD affected military surgeons just like it affected infantry soldiers, but it was rarely discussed in medical circles. "So you became a janitor," Dr. Chen said. "I became someone who helps keep people alive without having their lives in my hands," Eddie corrected. "I clean the tools you use to save people. I maintain the environment that allows you to do your jobs. It's still medical service, just ... different." He looked at Miguel Santos, now stable and breathing normally. "But tonight, when I saw that young man dying, I couldn't stand by and watch. He's the same age PFC Rodriguez would have been if he'd made it home." Dr. Foster, who had been silent throughout this exchange, finally found his voice. "Why didn't you tell us? Why spend 8 years mopping floors when you could have been saving lives?" Eddie's smile was sad but genuine. "I have been saving lives, just not the way you think. Every floor I've mopped, every instrument I've cleaned, every supply room I've restocked, all of that helps you save lives. And for 8 years, that was enough. It let me serve without having to carry the weight of life and death decisions." The trauma team stood in stunned silence, recalibrating everything they thought they knew about the quiet janitor who'd worked among them for years. "Will you consider coming back?" Dr. Chen asked. "We could use someone with your experience." Eddie shook his head slowly. This was a one-time thing. Miguel needed help that only I could provide in that moment. But I'm not ready to be a surgeon. Again, maybe I never will be. He picked up his mop handle from where he'd left it outside the trauma bay. Besides, he said with a slight smile, someone's got to keep this place clean for you. As Eddie resumed his custodial duties, the trauma team continued monitoring Miguel Santos, who would make a full recovery and return to his pregnant wife, with nothing more than some impressive scars and a story about the night a janitor saved his life. But word of what had happened spread quickly through Presbyterian Hospital. By morning, everyone from the department heads to the maintenance staff knew that Eduardo Vasquez was not who he appeared to be. In the weeks that followed, Eddie's routine remained largely unchanged. He still arrived at 10 p.m. and left at 6 a.m. He still mopped floors, emptied bins, and restocked supplies. But the invisible barrier between him and the medical staff had dissolved. Residents started asking his opinion on difficult cases, not officially, but quietly, in hallway conversations disguised as casual chat. He never overstepped his role, but his insights, gained from years of combat surgery, often proved invaluable. Dr. Martinez began leaving medical journals on the break room table, where Eddie ate his lunch. She never mentioned them directly, but she noticed they were always gone by the next day. And sometime later, she'd find them neatly returned, with small handwritten notes in the margins. Observations that showed Eddie was staying current with advances in trauma surgery, even if he wasn't practicing it. Miguel Santos returned to Presbyterian 6 weeks later with his wife and newborn daughter to thank the team that had saved his life. When he learned that the crucial intervention had come from the hospital janitor, he insisted on meeting Eddie personally. "Thank you," Miguel said simply, holding his daughter in the same arms that had nearly bled out that February night. "Thank you for seeing me when I needed to be seen." Eddie accepted the thanks gracefully, but deflected credit to the trauma team. That was his way, essential when needed, invisible when not. Dr. Chen eventually learned the full story of what had happened in Afghanistan. How Major Eduardo Vasquez had volunteered for deployment despite being eligible for a stateside assignment. How he'd established protocols for battlefield surgery that became standard practice throughout military medicine. How he'd earned a Bronze Star, a Silver Star, and the respect of every soldier who'd served under his care. And how one night in Kabul, when insurgents attacked his field hospital, he'd made the choice to stay behind and operate while everyone else evacuated to safety. For 6 hours, while rockets and mortar fire rained down around them. Major Vasquez had worked to save the lives of wounded soldiers who couldn't be moved. He'd saved 13. But PFC Rodriguez, just 19 years old, from El Paso, Texas, had died on the table while Eddie worked desperately to repair damage that was simply too severe. The guilt from that loss, combined with years of operating under combat conditions, had broken something inside Eddie that civilian life couldn't immediately repair. So he'd found a different way to serve, a different way to be part of the mission to save lives. At the Human Stories, we believe that healing takes many forms. Sometimes it means picking up a scalpel. Sometimes it means putting it down. And sometimes it means finding ways to serve that don't require carrying the full weight of life and death on your shoulders. Eduardo Vasquez never returned to surgery full-time, but he remained at Presbyterian Hospital, continuing his quiet service in the shadows, always ready to step forward when someone needed saving. Because some heroes wear scrubs and hold scalpels, others wear navy blue uniforms and push mop buckets. But they're all part of the same mission, making sure that when someone needs help, someone is there to provide it. Tell us in the comments, have you ever discovered that someone you overlooked had an extraordinary story? What did you learn from that experience? And from what city are you watching this story unfold? Subscribe to the Human Stories for more tales about the hidden heroes among us, the second chances we all deserve, and the many ways people find to serve others even after their lives have been changed forever. We'll see you in the next story. And remember, the person cleaning the floors, serving the food, or collecting the trash might once have saved lives in ways you can't imagine. Everyone has a story worth knowing.